are close to giving the first COVID-19 vaccines here in the United States. Those first doses will go to healthcare workers and the elderly. Experts say a COVID vaccine for the general public will likely be ready next year. Federal guidelines currently letting private employers require vaccinations that are FDA approved, but should your company make you get one? And can they in this case? Joining me now live is Dr. Ryan Bojrab, Senior Director of Health Strategy with First Person. Doctor, good morning to you.
Good morning to you.
All right, now if you can, and can we yet, clear up whether companies can make us get the COVID-19 vaccine?
At this time, we don't have specific guidance on the COVID-19 vaccine. However, in response to the flu pandemic in 2009, federal guidelines allowed employers to require vaccinations, subject to limited exemptions. We believe they will do the same with COVID-19. As employers are considering mandating or not, consider this. In a recent Gallup poll, 42% of Americans are still hesitant to get a COVID vaccine. Speed of development was the most cited reason to not vaccinate, and there are also individuals who fear the vaccine.
Now, I know testing for the most part has been free, but what about vaccinations? Should companies pay for the vaccination? I know they come with a varying price tag.
So first of all, where to get the vaccine. When the vaccine is available, we encourage employees to receive the vaccination at a healthcare facility, such as a doctor's office, retail pharmacy, and hospitals. In regards to paying, the CARES Act that just recently came out requires employer-sponsored health plans to cover the vaccine at no cost to employees for the duration of the public health emergency. Medicare just released the payment for the 2-dose COVID vaccine at $45.33, and we don't expect it to go much higher than that due to the production of the vaccine has been federally provided by grants.
Now, oftentimes we talk about herd immunity, which is, happens because so many people get a vaccine or they get it. So what do you do if employees are upset that some of their other coworkers are not getting the vaccine?
First, under the HIPAA Act, an employee should not know if another employee received the vaccine or not. However, if an employee happens to tell a coworker, it's their choice to receive the vaccine, and they could not decide to receive it due to religious or personal beliefs.
So I know you've been giving advice to several local companies already, even though the vaccine will not be broadly available for months, at least to the majority of people. What have you been telling them?
I recommend an employer's decision aligning to their company's values, mission, and vision, and consider how the decision will affect their culture.
So it's that simple. It's basically, you do what you want, you do what you want. Is that kind of the situation you're thinking?
Well, we'll give you an example on the flu vaccine. Most employers today outside of healthcare institutions don't require or mandate the vaccine. They just provide an opportunity for individuals either through on-site flu clinics or provide the opportunity to take some time away from work to get the flu vaccine. So I could see the same thing happening around COVID-19 vaccine.
Yeah. Tendency to agree, a lot of people would. Thank you, Dr. Ryan Bojrab. We do appreciate your time this morning.
Yeah, thank you for the opportunity.
Not a problem. If you'd like more information, go to fox59.com/links.